This is home. Yeah, I don't think I'll ever live on land again now that I've been on the boat 11 years. Winter's a little tough, you know, you get rocked around, sometimes you get thrown out of bed. I need a little bit bigger of a boat, but everybody who has a boat says that usually.
I have one daughter that lives in town here in Bremerton, and she has 2 children, a little girl that's 2 named Addison, and Trey is 5. And they come over a lot because they love to see Grandma and Grandpa. I love having them close by.
I am 27, and I'm married with my husband, Clint, and we have a son that is going to be 3 on Monday. For being someone that's so little, he always is very caring and aware of you. He's a very big person in my life. I was at work and I got the phone call. She tells me, you have stage 2 breast cancer.
He goes, I do not like what I see. And I'm like, well, what do you mean? And he goes, well, you have cancer.
I just remember her talking, but hearing some of it, and I was taking notes. I still have my paper where I was taking the notes as she was writing, as she was talking to me.
You have HER2 positive, estrogen positive. It just gets to a point where you're like, what? Like mumbo jumbo.
And your heart leaps out of your chest, and all of a sudden your world changes in an instant.
Knowing that, okay, Andy was going to come home from work, and to tell him, guess what? The test came back, and so.
Sometimes when people hear cancer, they think, well, that's just the end of everything, but it's really just the beginning of a new phase of trying to figure out how to fight it, how to live with it, how to survive it. And I think when you live in the same place as the people that you take care of, you can kind of see what their daily life might be like and relate to them a little better.
It puts us more in touch with the patient's environment. So if their family's here, their spouse, they're all oftentimes joining in on the visit. It's less about just the disease and more about the whole patient, and trying to bring that into their care as much as possible.
There's so many ways to approach symptoms connected to cancer treatment that don't have to be about pills and medicine. So I like to think that we try and get people thinking about more creative, individual approaches.
I always tell people it's not this pretzel yoga, where you bend at all different shapes and sizes, and but a lot of it's breathing techniques that have really helped me through the surgery part of it, because before I just let surgery and chemo and things happen to me, and I didn't realize that I could breathe and do things to help myself come out of it,
When I tell the doctors I do yoga for exercise, they say very good. And then I say, well, actually it's shooting pool, but it's a lot like yoga because you've got a slow stretch. I shoot lefty and righty. Pool is my yoga and my meditation to boot.
When patients come to the clinic to be seen, they see their physician every time. They see the same nurses, same reception staff. So it becomes a family of sorts. I think it provides that intimacy that you wouldn't get otherwise.
Being in a community like this and getting your care in a community like this, everybody has a vested interest in making sure you get the best care possible, and they go that extra mile. Whereas if you're a number in a big institution, it's harder to quite do that. You don't know the patients well.
Having people be able to stay in their communities and still treat or fight their cancer is a huge bonus. I think when you take somebody and have to send them far away, it puts such an additional burden and strain on a time in their life when they've already been dealt a huge stress.
What really made me decide to go to Paulsbo, I felt like more connected there, but also my son. I mean, there was no way that I could travel that far and be on a ferry and come back. And, it just wasn't in the cards.
Community and local healthcare especially that type, serious health care. I would have never made it if I had to go to Seattle.
You may never have been at this place before. You put your little paw down on the path. You think you're all alone. You are surrounded by people who have been here before and have lots to tell you and teach you about how to go forward. You are not alone.
If I was sick, I just would always say, all right, you gotta stand tall. If I can be grounded from my feet, then I can be strong. That was really important to me. I constantly go back and say, oh my God, last year I couldn't even walk up the stairs. And today I washed my car, I worked out, I picked up my son from preschool. So it makes you really appreciate how far you've come and how strong you can be.
Andy is a bike rider, likes to ride bikes and things. And I had just told him that my goal was I wanted to get my stamina up so that I could actually ride my bike across the Narrows Bridge and back. And then the cancer happened, and he goes, I can get a bike and I can put one of those wagons or something on the back and I can take you across the bridge. I said, that's not the point of it. I want to do it, And so now that's another goal. I would like to start riding bikes and get my energy, my stamina back up. I need to do things, and doing things gives me energy and makes me feel better. This I can bounce back from, and I'm ready to start bouncing.
I met really, really good people dedicated to what they're doing. I found out that I'm stronger than I thought I could be. When you think you're gonna give up, you don't, The will to survive is strong in all of us, I'm sure. Humor is important in healing. Me and my doctors always joked around. I feel good. I know that these people that helped me survive in many, many ways, I know they're going to be my friends for life. It's just a whole nother community that is mine now, a medical community. And I'm not afraid to go to a doctor anymore. They cured me of that.